Hi, I'm Kathy. I'm a dental hygienist for Dr. John Korolewski, the dental health coach.
And I'm Gina.
Today we're going to give some tips on structured chart, the dental fitness charting, software, and how to use it on patients, and talk to patients.
So we start by bringing up the dental fitness chart on the computer. And what we're going to do first is enter a new patient. So we go to the icon of the person and we go over here to add new patient. We enter their last name.
Make sure you type it in correctly, because once it is in there, you can't change it. Once you have the name in, click Complete Add.
It usually pops up on the top, but not always. You need to click on the name and press OK. Now, we do Dental Fitness Probe 6 sites. That's what we use. We do not use the STND Perio 6 site. We go to Dental Fitness Probe 6 sites and press OK. Next, you need to go where it says Element, and you need to bring down the tab and click on Perio. So right now, for the Element, we have Perio, and for the Pass, it goes right to missing teeth. You can do missing teeth in more than one way. You can add it manually, or you can do it voice. We'll first do it manually, and we can show you voice later. When you have the missing teeth in the Pass, what you need to do is always look on the left-hand side here. The red box will tell you what you're charting. The red box is now around missing, meaning we're charting missing teeth. So you need to go up to the dentition icon. Click on that. This chart will come up. If you take a look here, this is present, missing, unerupted, and so on. If you're charting missing, there should be a dot on missing, and then you can click on the tooth.
You can either click on the individual teeth that are missing. If it's just wisdom teeth, you may click on this button. It'll take the wisdom teeth off. If they have premolars extracted because of ortho, you can click on this tab. And as you see, upper arch, lower arch, I don't know why you would do a full mouth. If you made a mistake and you need to add teeth back in, click present, and it will bring it back to what you want.
Full mouth.
For our purposes, we're going to have the wisdom teeth missing.
And then you click OK to get back to the main screen. Next, to get started on charting, you again go to Pass, and you bring the chart down and you click on Plaque, Pocket, Bleeding. I click on Plaque, Pocket, Bleeding one more time. If you go up there, click that, and click on it one more time to move this red box to the start position, number 2. And if you take a look on the left-hand side, the red box is on Plaque, and that's where we're going to start with our charting. So everything we explained to you so far, you can do before you seat your patient. You can have all of that ready, have their missing teeth done, and you can seat the patient and start explaining to them the charting process. So I seated my patient, and I start by explaining the dreadful story to them. So I would start by saying what we're going to do today is we are going to measure the level of plaque in your mouth. Basically how effective you're being at home with your brushing and flossing. Now, have you ever thought of any goals that you have for your teeth or gums? How do you want your mouth, now, 10 years from now?
I want my teeth.
You want to keep your teeth?
I do.
Okay. Why is that important to you, or why do you want to keep your teeth?
Well, I work in a job where I should have a nice smile, so I want to keep my teeth.
Okay. Okay. So what we'll do is we will go through this measuring and we'll see where you're at, if you're on track with that. So what we're going to do first, I'm going to say yes or a no to plaque on your teeth. Plaque is your enemy. It's a soft deposit that you can brush off. It basically causes all of the problems. Causes gum disease, causes cavities. So I will say yes or no first to that. Then I'm going to say a number. You have a collar around each tooth, and I'm going to measure 6 areas. If you take a look here, 1 to 3 is healthy. Why is 1 to 3 healthy? Because you can get your brush and your floss down into that pocket depth and clean all the plaque out of those areas. 4 millimeters is gingivitis. You might have heard of red inflamed gum tissue before. That is gingivitis. 5 millimeters is early to moderate gum disease. The pocket depth is deeper, but if you take a look here, this is the bone. Bone is what holds your tooth in. 5 millimeter pocket, the bacteria is eating away that bone. 6 millimeters, you can tell here, you have more bone loss. 9 to 12, the patient who has 9 to 12 millimeter pockets will eventually lose their tooth.
Some other things that I say to patients, sometimes when they have no bleeding or no plaque on the tooth, you can say healthy and the number as you're charting. So I will let them know that. I will let them know if an area doesn't bleed immediately when I am probing. I sometimes have to go back and tell the program delayed bleeding, and I say some words that they might not know, and it's just telling them where to chart the bleeding. Now, Gina has put the headset on. We moved the charting from that monitor to the monitor on the unit, the dental chair unit. This is so the hygienist can track and make sure that the voice activation is tracking everything correctly. Now Gina will demonstrate the voice activation charting.
Start listening. Yes to no. Yes to no. Yes to yes. Yes to yes. Healthy to. Yes to no. Yes to yes. Healthy to. Yes 3 yes. Yes 4 yes. Yes 5 yes. Healthy 3. Healthy 2. Healthy 2. Healthy 2. No 3 yes. Yes 2 no. Healthy 2. Healthy 2. Healthy 2. Healthy 2. Yes 2 no. Healthy 2. Healthy 2. Delayed bleeding. T2. T2. Direct buckle. Record. T3. Direct buckle. Record. Okay. Stop listening. Just a side note when I'm talking about delayed bleeding. When you bring it up, if you have more than one spot, you always have to say record after it. If you're just recording one spot of delayed bleeding, you can just say okay, and that part of the chart will go away. But if it's more than one, make sure you say record after, or it will not record. Start listening. Yes to no. Healthy 2. Yes to yes. Yes 3 yes. Healthy 2. Healthy 2. Yes to no. No to yes. Healthy to. Healthy to. Healthy to. Healthy to. Yes to no. Yes to yes. Yes 3 yes. Yes 4 yes. Yes 5 yes. Save. Yes 5 yes. Save. Stop listening. Now at this point, before I say stop listening, I always say the word save. So to make sure that it has saved what I already recorded. I'm at the halfway point now for the maxillary. I stop and I ask the patient, any questions?
Yes, what does that all mean so far?
Well, remember when I was showing you that chart, the first yes or no means that you have plaque on your teeth. That was your enemy, the soft deposit that you can brush off. The pocket depth number is the next thing that I'm saying. And the last thing is if you had bleeding or not. So the first yes or no plaque, then the number, and then bleeding. And if I just say healthy, there is no plaque or bleeding on the area that I'm measuring.
Okay.
Start listening.